National Cabinet will now meet twice a week to tackle these challenges with the vaccine rollout. It's the first time we've seen this level of engagement between the state and federal governments since the height of the pandemic. Is this a concession that things aren't going well?
Uh, I think that's true, and I think the part of it is just to, reform and get going again, get that war footing that we need to. But I think to some degree, it's to kind of overcome sort of an overall negative perception of the vaccination program, which is actually quite disproportionate to where we are at the moment, and from a personal point of view, really quite frustrating at the moment. So I think part of it's just to reset, overcome some of the look. There has been some mistakes, there has been some poor expectation management, but I think to some degree it's to overcome some of the politicisation of this, which is actually damaging the actual program in itself and affecting the confidence.
Well, what sort of politicisation, what messaging then around the blood clots and the bumps in the road, what should the messaging be, do you think?
Well, look, I think, this is what I put you. There have been some mistakes. There has been some, expectation management, which I don't think has been the best. But look, from a doctor's point of view, let's just look at my point of view, having to talk to a patient, it has been somewhat frustrating and upsetting that this politicisation and some degree the media not being able to properly convey relative risk about the vaccines. And to some degree, it sort of damaged the actual public confidence in the vaccine in itself. And to some degree, what I'd like to say is, to in the nicest possible way to the public, but also the media, we all need to get a grip. Actually, we need to get a grip that really we've got these vaccines. We're able to, which we didn't think we'd have maybe a year ago, we're able to deliver it in a non-COVID free environment. And what we need to do is for everybody just to see the wood for the trees, but support the normal doctor-patient relationship that normally happens so that we can, as a doctor with a patient in front of me, properly convey the risk, but also the benefits of this vaccine, which are enormous, and to get to that point. Because at the moment, the sort of microscopic focus on what's going on and with things, and look, I accept, there have been 2 cases of this very rare condition for the AstraZeneca vaccine out there. But look, the problem is that this microscopic focus is not really conveying the relative risk. And the actual media, to some degree, is acting a bit like the Heisenberg observer bias, which is that the media focus on things, and inability to actually see the wood for the trees is actually affecting the confidence and may stop people getting vaccines that they would normally have.
Well, is it the media to blame here, Dr. Moy? Because we've got a situation now where Australia has paused Johnson & Johnson, the US is doing the same, the EU, over blood clotting concerns. So we've got a situation where are people losing confidence in the vaccine?
Oh, look, I think to the last point, I think there is, but there is a bit of everything. There is actually there's been mistakes made, and everybody will count that. And I think there has been some politicisation. I think we just got to get everybody to back off on that, because that's really not on. I think to some degree where the media comes into it is actually properly conveying the risk. And look, I understand the media. It's really important to be able to look at important stories, and I think people look at it. But you have to also be able to look at the other side, because look. In terms of when I have a talk with a patient, I'm actually talking about risk benefit to them. Look, every day, like the woman coming in for the pill, I'm talking to them about, look, if you go on the pill, you're not going to get pregnant, but if you do go on the pill, you could get pregnant. The risk is that you have about a 1 in 2,000 chance of getting a blood clot every year, and that is obviously not good. Now, I think that's where we need to get to in this debate, and I think it would be great if we could, because my problem is that there are people actually cancelling their appointments at the moment even in the over 70s group at the moment. And the problem then is that, later on, if COVID was to break out, that they may actually get COVID, and to some degree what's actually happening at the moment could actually affect their health and welfare later in the year, which I think would be a terrible thing.
Let's talk about Johnson & Johnson. As I said, the government has decided not to back the 1-dose vaccine. The US, the EU, South Africa coming out overnight doing the same. Is that the right decision?
Oh, look, in Australia, it makes total sense, because essentially it's based on the same technology as the AstraZeneca vaccine. And look, if there is an issue about us having to restrict the group that we need to restrict it to, which is, say, over 50s because of this condition, we've got heaps of the AstraZeneca, so we don't need the Johnson & Johnson. So essentially that's a really simple decision that you don't need to go down that line. So as far as that's concerned, that kind of makes sense.
The government has also abandoned targets and setting timeframes for when Australians might be able to at least receive their first dose. Do you support that, or do Australians have the right to know when they'll be vaccinated?
Oh, look, yeah, look, I think this is very interesting from my perspective. I kind of got to see inside behind this. Initially, these were targets for planning, but they became somehow promises along the way, and I didn't think that was probably the best idea, because to some degrees these promises have really were actually made even before the vaccines were approved, and we knew there'd be supply problems from overseas. But what it's done is actually come the fact that, in fact, the real problem at the moment is supply. It's supply of vaccines. Now, the thing is everybody's going, well, we're not getting that many out there, but part of it's just we haven't been able to get the supply. And if you really look at that, that's occurring in every country that's done well. And our people are going, oh, New Zealand, they're so fantastic. They've ordered so many Pfizers to cover their population. Well, as you actually look at the numbers, they've done very little vaccination, 100,000, I think, which is really terrible. And they're having the same debates over there because it's the supply issue which is the thing. And that, unfortunately, is the limiting factor in Australia. Now, we're in a great position because we're going to make the AstraZeneca, which actually may still turn out to be a great decision.
But is it a great decision, though, at this stage? Under 50s, the advice is don't have the vaccine.
Oh, look, but let's stand back and look at this. The AstraZeneca vaccine is a very safe and effective vaccine, particularly in the over 50s. We know the over 50s are most likely to die from COVID or get severe disease. We also know they're the least likely probably to get this strange allergic reaction, which is occurring at about 1 in 250,000. Now, the thing about it is that we need to vaccinate that population, and that's that's the highest risk population for us, and we will have guaranteed supply as long as CSL can get going with their supply. So if we can get that population vaccinated, we'll actually be in a really safe place, and then we can slowly potter through with the Pfizers with the under 50s as it comes on. But the problem with the Pfizer, which I think everybody doesn't really get perspective on, is that all the countries that are really needing it, like in Europe and overseas, are just keeping it, and the supplies to us are only going to be steady at the moment. But that group is still less risk than the over 50s, because age is the single biggest risk factor for severe disease and dying from COVID.
All right, Dr. Chris Moy, it's a big topic. We appreciate you taking us through it this morning. Thank you.
It's a pleasure.